begin another part. So before that, previously I was like making video, so I just thought I should at least tell the definition of the migraine. So migraine, it is an intense headache. Okay, headache means we know further then that is very intense in nature, plus that with that the patient is feeling nausea and vomiting type. With that the patient is feeling like vision problem. Okay, that may be like blurred vision or dizziness, these all. Okay, so with headache, with intense headache, so that is the migraine. Now we will continue. So the migraine management, we can give triptan. Okay, but see, we are giving triptan, but we should be considering some points over here. Like for example, these triptans, they are contraindicated, means we should not give in such cases. For example, we can give in migraine management, but we can't give this triptan in case of ischemic heart disease. Ischemic heart disease means when the blood supply to the heart is not enough, and there will be like a certain disease under this category. So that is ischemic heart disease. Number one disease in that is like MI. Okay, so basically MI is a heart attack. Okay, so in that we can't give this triptan. Why we can't give? Basically, see, triptan, I have told that triptan is a vasoconstrictor. Okay, so it is a vasoconstrictor. So in the migraine, what is there? There is vasodilation. So that's why we are giving here like this triptan. The vessels are dilated in the migraine, so we will constrict it in simple thing. But why the triptan is contraindicated in other these problems? Why so? For example, let's take MI. In MI also, what's happened is that the vessels are already constricted and the blood is not supplied enough. Okay, to the heart. Okay, so blood is not reaching enough to the heart. So if we'll constrict more these vessels, what will happen? Suppose if I have constricted more these vessels, so blood can't move forward. So it will, what it will do, it will increase this problem, it will increase this MI, it will increase heart attack, patient will be in critical situation, patient might die also. Okay, so that's why the triptans are contraindicated. We should never give it in case of MI and ischemic heart disease. And also same theory in case of hypertension. In hypertension, what is happening? Again, there is vessels are constricted, so again we should not give this triptan. These are contraindicated. And in case of pregnancy also, these are contraindicated. Then also in, if the patient has like liver impairment or renal, means kidney impairment. Okay, renal impairment is there, then also it is contraindicated. Then comes this lesmeditan. So lesmeditan also we can give in case of this migraine management, and it has like less MI risk. So less MI risk, so that's why we can just give it. Another one is like ergotamine and dihydroergotamine. These are like ergoids group, but the complication, or we can say the side effect, can be if we are giving to the patient the ergotamine and dihydroergotamine, there can be gangrene of the end arteries. Suppose if this is our hand, and in this our hand there are these arteries are going, so these are end arteries. End arteries means there is like on suppose this area, so on this area only this artery is supplying, no other artery is supplying. Okay, usually in our other body parts, what happen is if one artery is supplying this part, another artery can also be supply this part, but end artery means that there is only that one artery and no other artery. So what will happen? These ergoids will affect this end artery, and the blood supply will not be enough, and there can be gangrene of this. Okay, then there can be pain also. And also for that, if the gangrene happened as a side effect, then we can give as a treatment nitroprusside. Then comes this for the like acute attack of migraine, we will give the these ergots with the caffeine. Ergots plus caffeine is given. Then some new drugs are like CGRP receptor inhibitors. So these drugs are, for example, rimegepant and the ubrogepant. So from the gepant's name. Then also we can give for migraine opioids also, like for example butorphanol. Then I have already told that for the migraine prophylaxis, the drug of choice is what? It is the propranolol. Okay, then another drugs for which are used in case of the migraine management, these are like gabapentin, these can be like valproate, these can be like nortriptyline, and these can be like topiramate. Okay, nortriptyline. Okay, so these are the management of the like migraine. These are the drug used in the management of the migraine. So that's about the serotonin.